Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is today discussing the health issue of doctor population ratio in the context of Pakistan, South Asia, and at the global level, and particularly OECD, Organization of Economic Development, Cooperation and Development, OEC, for the postgraduate and new doctors may be a different thing, but it is basically an organization of economic and cooperation development. Uh, so let us see that World Bank data indicates that in 2020, this is the latest data available on the computer, the number of physicians per thousand people in South Asia ranges from zero point 0.3, while in the OECD, it is 6.3. So you can see what is the difference means less than one doctor per 1,000 population in some areas of South Asia. And you can see that in the OEC, uh, there are almost 7 doctors. So it is almost 7 times to 10 times difference between poor countries and rich countries. So with this, I think we are coming that per 10,000 or per 100,000 will be a better indicator. And the global average is that in 100,000 population, 170 doctors should be there. And you can see that from Maldives, we have sufficient doctors. And if you see Pakistan, we have almost 110 per 100,000 population. This is the latest data from the WHO and from the print. And even in India, it is less number. So you can see that the India, Pakistan, so there is the impression that there are many doctors and we don't require more colleges. But the data indicates that we have even 100,000 population required number of the global average 170 is not in any country except the Maldives. Uh, then you can see that the situation here, while we have uh, 2 digit doctors in 70, 40, maximum 100, and you can see that in Germany per 100,000, 450, in Greece 630, and in UK 300, and in United States 360. So we have to be vigilant that in Pakistan we need doctors, and there is a data that almost 30,000 doctors of Pakistani they have left this country, and we are still managing their gap. So almost in public sector, the government is spending about 4 million subsidy or 4 million rupees per doctor from the national taxpayers. And then you can see that in Pakistan, the doctor patient ratio is 1 to 300. This is another data published in the DOT, while the minimum suggested World Health Organization is 1 doctor per one. So almost 3,000 people are over the WHO level. There are different figures in economic survey. It is that even 1 doctor is for the 1,000 population, but this is another view. Then coming to the some important data provided by the World Bank is based on the number of physicians per 1,000 people, which can be converted to physician per 100,000 or even. So I have done this calculation and you can see that. According to the Pakistan Medical, the country has produced 2,000 doctors since the independence. The data from the Bureau of Immigration and Overseas Employment. This is one of the Royal Society physician which has written in the DOM. As per the labor force survey, Gallup 36,000 female doctors are either jobless or chosen not to serve. And since the independence, the data bureau 30,000 doctors have left Pakistan since 1970. So these are the few glimpses, and we can discuss more in our next videos as my throat is not fresh. So I will leave with one or two slides, and then uh, we can see that the globally as the world had 104 million health workers, means almost 10 crore and 40 lakh people are in the health sector, including 12.8 million physicians, means almost 1 crore 20 lakh physicians. So this number is required at the global level. And even the pharmaceuticals, we need 55 million, and midwives and nurses combined almost 40 million. So you can see that how much is the shortage. This is another slide. Across globe, 6.4 million physicians needed in 132 countries facing shortage. This is a research study by Richard Paichin. Study estimates 12.8 million doctors worldwide and are more needed. Across globe, 6.4 million physicians needed in 120. So you can see that how much is the gap. And the medical education requires a lot of rigorous training, quality, professional standard, as well as the human rights and occupational. So this picture is showing that one doctor is the crowd of many healthcare needy people, whether they are children, whether it is vaccination, whether it is preventive care. So the world situation is not better. We shall continue our topic in our next video. I am leaving with this, and we will discuss more in for Pakistan. And one figure shows that Pakistan is spending almost 1% of the GDP. But if healthcare is efficient and people are healthy, then it can provide to the country national exchequer or our revenue of 1.5. Means if you spend one, then you will have a 1.5% GDP. In the world data, almost 5% GDP is required to be spent on the healthcare so that universal healthcare and SDG goals are there, but Pakistan is spending almost 1% of GDP, while the South Asian average is 4%. This is written in the uh, economic survey of Pakistan. So with this, I think I am ending, and we will continue our this topic in almost 2, 3 more videos. Please, Dr. Hussain Bashkolachi YouTube channel will provide you insight, new information, and different perspective of public health and community medicine. The student of MBBS, a student of MCPS, a student of FCPS, MD, and even PhD, MPH, MSPH, and different nomenclatures can learn. Even public awareness can be useful so that our planners and the people who are at the helm of affairs can think that health is not a simple number game, but it requires a lot of ethical training as well as lot of cultural and many other emergency situations to be dealt as Pakistan is facing the climate effect, heat waves, fog, floods, earthquakes, landslides, and glacier fast melting. We call it GLOF, glacier lake outburst. So this situation in Pakistan, PMDC should consider and improve the medical college conditions and not focusing on the MD-CAT. It seems that in Pakistan, MD-CAT is the only solution for all health problems, and every doctor will be good, while general education, board education, and primary, secondary, tertiary education also makes a person to understand the society, the situation, the geography, as well as the social and cultural patterns and cultural landscapes. Without understanding these, health cannot be provided through hospitals or through stethoscope. Thank you very much, Dr. Osen Baskolachi YouTube channel is with you. Thank you.